I'm Estelle Verburgh and I am a hematologist at the University of Cape Town, working in Groote Schuur Hospital. Lymphoma is a cancer of the blood-forming organs. It usually is found in lymph nodes. Lymphoma is one of the top 10 incidence cancers in the world, and it's in the top 5 for good outcomes. However, because lymphoma is part of the blood-forming organs, it has a way of hiding itself, because as we know, blood is everywhere and the lymph nodes are everywhere in the body, which means that it's very difficult for a non-hematologist or a non-lymphoma specialist to make the diagnosis of these cancers. Lymphoma diagnosis means that there has in the first place to be a suspicion for the patient having lymphoma. And there are many competing diseases that can give symptoms and signs that may overlap with those of lymphoma. And that is a huge problem, especially in an HIV and TB endemic area, such as South Africa. Symptoms such as weight loss, fevers, and a swelling of the lymph nodes that we call lymphadenopathy is also often more associated with infectious diseases than with cancer. These symptoms are very debilitating. They encroach upon a patient's functioning and his quality of life. The sooner we diagnose lymphoma, the higher our chance of curing it. So it's important to make this diagnosis quickly and get a patient to treatment quickly. We know that we can cure patients with lymphoma with chemotherapy. The next problem is the barrier to actually getting tissue for a diagnosis. First, there has to be the suspicion on the part of the healthcare worker. That is where the health system sometimes falls short, and healthcare workers are not endowed with the right tools to make a good diagnosis, because they are the first line of defense. They are the people who would see patients with lymphoma in the first place, that they are able to access these tools. And then there has to be the opportunity and the tools to get a proper diagnosis of lymphoma, which will always include tissue. Getting a biopsy of a lymph node, a biopsy of a bone marrow. There is a common practice amongst healthcare workers to put a needle into a swollen lymph node and extract some fluid for it for tests. What we have pioneered at Groote Schuur Hospital is to always conduct such a test together with a very specific, new, very sensitive molecular test for TB diagnosis. If that has been done at the very first stop at your healthcare worker, then TB can be diagnosed or ruled out. That then makes it very easy to decide if this patient needs a biopsy of the lymph node afterwards. And that should happen as soon as possible. Lymphoma is much more common than the general public realize, and also much more common than the typical healthcare worker would be aware of. Hodgkin lymphoma is one of the most treatable and curable cancers that there are, and other subtypes of lymphoma that we also treat also have a majority of patients having long-term survival after treatment and cure.